You're watching TVC Breakfast. Now, measles is a highly contagious disease that accounts for 13% of all vaccine-preventable deaths in children younger than 5 years in Africa.
This year, every state in Nigeria has recorded a case of measles, but Katsina, Borno and Yobe states take the lead in reported cases of measles.
According to the World Health Organization, countries in Africa have experienced a resurgence of measles, including outbreaks reported in at least 9 countries in the last 12 months.
Nigeria, however, has the most children unvaccinated and under-vaccinated against measles in the world, with nearly 4 million children under 1 year missing out on the first dose of the vaccine against measles in 2017 alone.
And the United States is also battling a measles outbreak in New York City, where a state of emergency was declared in Brooklyn for having the highest number of cases of measles by the city's public health. In California, 2 universities have quarantined hundreds of students and staff amid a measles outbreak.
Institute of Health is calling on religious and community leaders to convince people to get vaccinated following a measles outbreak in New York.
In the Williamsburg section of Brooklyn in New York City, it is mostly people, particularly in that closed Hasidic Jewish community, who don't want to get vaccinated. And we need the religious leaders, we need the community leaders to kind of convince those people that they need it to protect not only their own children, but they have a responsibility to the community and to society to help protect the community by developing this umbrella, as I said, of herd immunity.
The United States declared measles eliminated from the country in 2000 because of widespread vaccinations, but unfortunately, measles has resurfaced as vaccination rates declined in recent years. The outbreak is part of a broader resurgence in the United States, with 465 cases reported in 19 states this year.
The federal government has never made those kind of dictates from the federal level and have left it up to the state and local health authorities. And it works well at the state and local health authorities. So what you're seeing with the mayor of New York, what he's trying to do, I think is inappropriate to try and break this cycle of a very serious outbreak. He's actually declared a state of emergency in the city of New York.
Well, joining me via Skype from Abuja is the Incident Manager, National Emergency Operations Center for Measles, Dr. Uyiladun Okunromade. Thank you for joining us on TVC Breakfast. Now, there seems to be a resurgence of measles, not just in Africa, but even in the United States. What is at the root of this?
Okay, thank you. Currently, we're experiencing measles outbreak globally, and Nigeria is part of it. And the cause is largely due to low immunization coverage globally, that parents refusing their kids for getting the measles vaccine. And in Nigeria, basically, we have a low rejection as well. Low rejection, and there is a very low coverage of measles immunization, especially in the Northeast. And this is due to some security challenge that the community areas have experienced in the past. And some communities were inaccessible during the immunization campaign, measles immunization campaign that was conducted last year. And because of this, we're experiencing a resurgence in measles outbreak, largely affecting mostly children between age 1 to 4 years.
Now, what is this fear about the vaccine? It does beyond the issue of the security issues, rather. What other issues could be stemming or fueling the fear that parents have and are rejecting this vaccine?
Okay, so the fear is actually not true. We're trying as much as possible to mitigate against this. And we try to engage the public. We carry out public enlightenment to ensure them the vaccine is safe, a vaccine is effective, and is the most effective way of preventing against vaccine-preventable diseases, of which measles is one of them. And there is no basis for any fear of rejection. And this we have been able to mitigate by public enlightenment and engaging community influencers, especially traditional healers, as well as the religious leaders. we try as much as possible to also engage men. We involve the male partner involvement in these activities to ensure that mothers get the necessary approval to take their kids for immunization. So the vaccine is safe, it is effective, and it is free.
But there are some areas beyond the northeast where we have security challenges, like you have rightly mentioned. In this area, some places, some persons complain of not having access to the vaccines.
Yes. So because of those challenges, that is why we're having a high impact of measles outbreak this year. So far, we've recorded over 20,000 cases, and 50% of these cases are coming from the security challenge area. And there is also the challenge of rejection as well in some of these communities. So aside the security challenge, we also have some communities that reject measles vaccination.
You're watching TVC Breakfast. Measles is a highly contagious disease that accounts for 13% of all vaccine-preventable deaths in children younger than 5 years in Africa.
This year, every state in Nigeria has recorded a case of measles, but Katsina, Borno and Yobe states take the lead in reported cases of measles.
According to the World Health Organization, countries in Africa have experienced a resurgence of measles, including outbreaks reported in at least 9 countries in the last 12 months.
Nigeria, however, has the most children unvaccinated and under-vaccinated against measles in the world, with nearly 4 million children under 1 year missing out on the first dose of the vaccine against measles in 2017 alone. Well, joining me via Skype from Abuja is the Incident Manager, National Emergency Operations Center for Measles, Dr. Oyeladun Okoromade. Thank you very much for joining us. Now, access to vaccines, it's a huge problem. How do we mitigate that?
Okay, so the huge problem we're facing, especially security challenge area, it's accessibility to those communities, and to mitigate that, we've engaged the Joint Task Force to ensure that some of these communities are well covered. They're involved in our vaccination exercise.
Good morning, Ajay. What's the mission today?
This is major activity that we're implementing to mitigate against this effect.
But is that enough to solve this problem? Engaging the Joint Task Force, will that help ensure that we have vaccines get into areas that are hard to reach?
For now, yes, they're enough to ensure that this area are easily well covered and well accessible. And the Joint Task Force, the military, and the security generally, they're the ones giving us the kind of the backing to ensure that we're able to reach those security challenge area, which is yielding a lot of positive response. So far, especially in Borno, we've immunized over 500,000 children in those communities, and there is also a plan in place to cover the other affected area.
So you're telling us that in as much as you had reaching those areas are hard, the awareness level is quite high.
Yes. Now, we also experience low rejection in some of those communities, but we've engaged, we're involved in a lot of public enlightenment now. We've engaged community influencers, the traditional healers, the religious leaders in those communities, and we've also, looking at the cultural setup, we've realized that our men are important, especially in Tombura communities. A lot of mothers won't take their children for vaccination except they get approval from the men. So we've also engaged men in some of our vaccine strategies. We've set up a male partner involvement activities. So these are part of the community engagement and the public enlightenment that we're involved in to ensure that apart from getting this vaccine to them, we ensure that they come out to take this vaccine for their children.
All right, in all of this now, are you concerned about practitioners who administer these vaccines? Are you concerned about their training? How capable are they to administer these vaccines?
Yes, as part of our strategy, we've also engaged the health facilities. We've trained health facilities in the affected areas on case management to ensure that apart from when these children when they are on admission, the main goal is to ensure that they get supportive treatment as quick as possible to prevent complications and to ensure that we administer this vaccine to the affected children within the community, not just the affected children, but the entire community. This is to ensure we build a resilient herd immunity. So the health workers have been trained and retrained on these activities as well. This is what we're coordinating this aspect at the National Center for Disease Control through Measles EOC that has been activated to coordinate the response activities in the country.
All right, Dr. Oyeladun Okoromade, thank you very much for talking to us on this issue.